The best we could do. Sometimes you feel like that's all you can do. Younger patients with weird cells, enough of peripheral flow cytometry, looking for cancer. That's the best you could do. If you do it, you're like, oh, I've done everything. I guess you could tend to do a pan CT looking for lymph nodes to see if they have lymphoma. But that's risky. Peripheral flow is not it's just money. I think that's a difficult thing, right? What if the best is not enough? When does the medical field change from the best we could do, the standard that everybody else follows and adheres to doing everything under the sun? You hear about these cases. They're so rare they make the news. This man decided that, because DNA sequencing was now cheap and affordable, that his mother, who was suffering miserably from this T-cell lymphoma that is affecting her skin, yeah, he'll just look at the genome and see if he could figure out some sequences that they may have treatments for. Of course, he's an Intel engineer, pretty smart guy, quits his job, works on this full time, and finds something half a year later. Approaches the doctor, there's a melanoma treatment, gives it a shot. What do you know? She's good for a year. Not going to work forever, but she's good for a year. And then she's not suffering, and she's still alive, which is beyond anybody's wildest dreams, because she was suffering till now. And that's the thing. How far do you go before you give up? When do you say, I've tried? It's obviously a term that means different things to different people, right? Certain people try harder, certain people try less, right? How hard are you supposed to try before you say, I've tried? Who's the one to judge? I find this more an issue in clinic. I have a patient every 20 minutes. You got to keep up. What do you do for them? How much do you do? There's a difficulty in clinic because in a hospital, I could order stuff and it's faster. I could order stuff and the patient's there waiting for it on an issue. The patient in clinic, you order stuff, they may not do it. It may not fit their schedule. But if I get an appointment, are they going to drop everything and do it? Maybe some patients, maybe not others. There's a lot of reliance on them. And they're physically, if you're arranging something complicated like referrals, they're physically not there in front of you. Some people are more responsive via the phone, some people are less. I would say rarely is there, maybe older patients who pick up the phone all the time. Young people are busy, right? So what do you do? When do you say I've tried enough? When do you say I give up? I had a lady who said, "Oh, if I stop now, I feel like I'm giving up." She's in her 80s and has widely spread cancer, maybe one time, maybe two. Most of us say she's tried enough, but she feels like if she stopped treatment, she would be giving up. Why is giving up a bad thing? Why is it that when we grew up, our parents taught us that you should never give up? Because actually, I find giving up a very good thing, a very good release, a safety mechanism, if you will. For example, the people who commit suicide. Why do they commit suicide? Yes, you could say they're giving up on life. That's true. But many times, at least the people, say in medical school ones that were trying to become doctors, they're giving up because they can't handle life without medical school, without being a doctor. They feel hopeless. They feel there's no point in living. They're just still give up their dream and they'd still be alive and they could find a new life. Isn't that a good thing? Isn't that a good way of giving up? I would say so. But that's the thing. Who thinks so? Not them. See, the thing is, growing up, how do you feel if you can't handle it? What do you do? That's the question. I don't know. But I could tell you that I think it's better if you know how to give up. If you know how to say, hey, I've tried enough. Say, yeah, we're good. We're done. And just give up.